Turning a group practice into an IOP or PHP in Ohio changes your risk the moment you market the program. Ohio Revised Code 5119.35 requires certification for addiction services the state's rules specify as certifiable. And the licensure exception your practice operates under today may not cover a structured program. This is a diagnostic walkthrough for Ohio group practice owners where the risk changes, what to resolve before you market, and what to verify before you commit capital. We will cover the certification question, Medicaid and payer readiness, staffing and clinical leadership, and whether your current site can support the program. You may already treat clients with substance use disorders, with referral relationships, clinicians, and a local reputation in place. Current clients may be stepping up from weekly therapy into a level of care you do not offer. Hospitals, detox programs, courts, and employers are looking for structured outpatient options. And keyword data reviewed for this series showed meaningful demand around Ohio addiction treatment searches. Here is where practices get hurt, asking only whether DBH certification is required and treating reimbursement as an assumption. A structured program raises different questions about the entity, the service line, funding, clinical leadership, and how it is represented. Certification readiness and payer readiness are not the same. Medicaid enrollment, payer contracts, authorizations, and claims operations need their own answers. Before advertising IOP or PHP, verify whether your model remains ordinary professional practice or crosses into a certifiable program. Technology readiness matters too, and this is where Behave Health is designed to support the conversion. Behave Health's EHR, CRM, and RCM are designed to support admissions, group schedules, and treatment plan reviews, plus authorizations, staff credential tracking, and utilization review, through to Medicaid and commercial claims and reporting, the program-level workload a converted practice takes on. Before you announce the program, 5 readiness areas need real answers: strategic fit, certification, payers, staffing, and the site itself. First, strategic fit. The question is not, should we open a rehab? It is more specific. Are current clients stepping up into a level of care you do not offer? Can the clinical team support group-based addiction treatment without weakening the core practice? Would IOP or PHP revenue justify the added certification, billing, supervision, and compliance work? Second, the certification path under Ohio Revised Code. Section 5119.35 requires certification for mental health or alcohol and drug addiction services. Ohio rules specify as certifiable, subject to stated exceptions. There is an exception for licensed professionals within their authorized scope, including in a group practice, but a structured program may not fit it. Section 5119.36 describes the application framework and references accreditation and on-site review concepts that can affect your project sequencing. Third, Medicaid and commercial payer readiness, questions, not reimbursement assumptions. Ohio Medicaid Substance Use Disorder Treatment Services Rule references ASAM-based levels of care, with intensive outpatient and partial hospitalization within Level 2. Verify provider enrollment, program credentialing, medical necessity criteria, and documentation expectations. And confirm authorization review and level of care billing with Medicaid and each commercial payer before relying on the revenue model. Fourth, staffing. A structured IOP or PHP adds program-level operating questions your outpatient workflows never had to answer. Define the level of care, how admission and clinical screening will work, and how group and individual services fit together. Decide who provides clinical leadership and how treatment planning and discharge planning will be documented. Do not build staffing from a generic public matrix. Start with the population served and the rules that apply. Fifth, the site. Test the current office before the service is announced. Can it support confidential group programming and longer, more frequent sessions without disrupting privacy and flow? Does the layout work for screening, admission, family participation, and safety procedures, and do lease terms and local approvals align? If the site cannot support the model, revise the service design or location strategy before certification and payer assumptions become commitments. Use this as orientation. Then verify the Ohio path before you market or commit capital. Confirm specifics with DBH, Ohio Medicaid, your target payers, and qualified counsel. Use findtreatment.gov to understand the existing provider landscape in your target market. Behave Consulting helps operators pressure test the conversion before launch. Payer readiness, documentation workflows, admissions design, and implementation planning. Stop letting an unverified expansion put your group practice at risk. Talk with Behave Health to scope your IOP or PHP conversion. Book a demo at behavehealth.com. Book a demo at behavehealth.com.